This is the Work Smart Hypnosis podcast, session number 247. Dr. Fredric Mau on anxiety and trauma.
Welcome to the Work Smart Hypnosis podcast with Jason Linett, your professional resource for hypnosis training and outstanding business success. Here's your host, Jason Linett.
So before we actually get into this week's episode, you need to go to the show notes at worksmarthypnosis.com for a photo of myself, Dr. Mau, as well as Sheila Granger hanging out and holding a koala. Hey, it's Jason Linett here, welcoming you to the program. And let's rewind part of the story back to September this year, 2019, when I was invited out to give the closing keynote at the Australian Hypnotherapists Association Worldwide Conference. This event was happening in Brisbane. And as the saying often goes, as I've learned it to be for many of our conventions, let me fly somewhere else to hang out with the locals. That the setup of that event, the opening keynote was Dr. Fredric Mau from Columbia, South Carolina, and then, let's frame it this way, a bunch of Australian speakers, and then I closed it out. So they kind of put the Americans on the outskirts of the event, but an amazing, amazing opportunity. And I have to put Fredric in one of those categories of someone who I've known of for all these years. And quite honestly, the first time hanging out was, of course, walking around the Lone Pine Koala Sanctuary, as you do, and just really getting to know someone who truly was not only a worker in this profession, but also a true thinker about you're going to hear this in this conversation, about looking at where we can start to build protocols, build systems, build foundations of how we help our clients, but also when and where to break away from that. And just this one little rule that he shares in terms of his work, that when in doubt, work on anxiety. And if that's not working, work on trauma as a possible through line for the work. And really the whole mindset, you're going to hear this amazing dialogue about looking at the evidence-based approach to hypnosis, and even better, looking at the specific research that backs up what we do and how it is that we can begin to update our terminology beyond the old school bypassing critical faculty, bypassing the language of conscious and subconscious mind, and instead speaking specifically about the limbic system within the body, the part of us that drives that emotional landscape of our physicality, our physiological experiences, but then also a really succinct definition as to, well, how it is hypnosis actually works to address these things. So definitely a conversation you're going to want to take some notes on and follow up with afterwards. I'm going to link over in the show notes at worksmarthypnosis.com, not only to the koala photo, as important as that is, but also over to watermarkcolumbia.com, which if you head over to that website and specifically click on the upcoming events tab on that website, that's where you can see the upcoming conferences where Fredric is going to be speaking, the upcoming trainings that he's hosting, and plus there too, you'll see links specifically the 3 books that Fredric refers to in this conversation, which I'd happily endorse. Picked them up when we first met, and I'd happily endorse them, and there's some really workable information that's inside of there. And like many others who's been on this podcast before, almost a bit of a plea to you, the modern practitioner out there, to be out there, please work with hypnotic pain relief. Yes, of course, follow the appropriate ethical steps in order to do so. But on top of that, just looking at the nature that as soon as we get the body relaxing, it's not just the phenomenon of the Esdale state that you don't even have to suggest the full anesthesia, that it just may naturally occur. The simple nature of getting someone into that hypnotic state naturally begins to produce that hypnotic pain relief sensation, and by doing so starts to kind of clean up a lot of these, as we nickname it in this dialogue, those residual trance effects. So if you haven't yet heard Dr. Mau speak, you're going to hear a lot of really fascinating takes on things, some really workable strategies in his books, which again, I'd happily endorse. And again, the links are over at watermarkcolumbia.com. Click on the upcoming events tab, or just simply look at the show notes at worksmarthypnosis.com. We'll link directly from there as well. And while you're there too, check out hypnoticworkers.com. This is the all-access pass to my hypnosis training library, and not just techniques for change, but also full client sessions from genuinely walking in the door to walking out the door. Every word of it has been meticulously transcribed to model the specific language patterns and the how and the why why, and what to do working with your clients. Check that out and get the all-access passes today over at hypnoticworkers.com. And with that, let's jump directly into this content-packed session with a good friend, a good person to learn from, and an outstanding practitioner of hypnosis. Here we go, episode number 247, Dr. Fredric Mau on anxiety and trauma.
It was really kind of crazy. I got laid off from my corporate job because they laid everyone off and closed the entire office down. And I was running around doing some consulting work and looking to, make an honest living, and went to the Chamber of Commerce to meet other businesses in town and network, and ended up meeting a gentleman who owned a hypnosis place. He was with a group that at the time was trying to franchise hypnosis, which is kind of a strange thought to me now. At any rate, he said, you should come in and work with me. It'd be great. And I was like, that is completely crazy. But we kept running into each other, and I thought, well, this will be a lot of fun at parties. And I've got some extra time since I'm doing consulting work, so I may as well go ahead and give it a shot. I went over and started working with him, and it totally is fun at parties. But I saw how powerful it was to help people make changes in their life. I had a significant physical pain issue at that time around that time that it helped me with. And I just fell in love with it. And so eventually I ended up going into practice as a lay hypnotist, as a consulting hypnotist, and then subsequently wanted to up my game and got my license as a counselor. So I'm a clinical mental health counselor, a psychotherapist.
Yeah, I'd love to unpack that for a moment. What was that thought process, like you said, of the phrase around level up that game? What was the thought process to then begin as the hypnotist and then seek out the counseling license?
When I was working for the other gentleman, we were mostly doing things like smoking cessation and weight loss. And then, occasionally other things would walk through the door, like working with athletes. And I enjoy doing all of those things today. Those are still things that I do. What I found was people started coming to me with more and more difficult problems, stress and anxiety problems, depression, phobias, that sort of thing. And I was able to do a lot to help, but I knew that there were things that were beyond my competence or beyond my legal ability to work with. And I decided that in order to really best serve my clients, I needed to up my game. And so that was a process. I ended up getting an additional degree and going through the entire process of getting the license. It took several years, but that has really upped my game. I now am sort of the place where people come when there's something strange and it don't look good. So I treat a lot of stress and anxiety disorders. I treat a lot of phobias and that kind of thing. But I also get more esoteric things, conversion disorders. I do very well with tics and Tourette's. I actually perennially have a number of clients from within the psychotherapy community that end up coming to me, psychiatrists, counselors, psychologists as clients. I end up with a lot of referrals from colleagues where, they have worked with things and they've not gotten the progress that they wanted. And I was recognized by the State Counseling Association, the South Carolina Counseling Association, this year as the outstanding counselor in the state.
Oh, awesome. Congrats.
Mm-hmm.
So I love that dynamic, that's something that even as I guess I can be put into that category too of lay hypnotists, that, just to kind of pull back and realize these are still people, that here's the time that it's the doctor and as the client, here's the psychotherapist and as the client, here's the local hypnotist and as the client. Do you tend to find that there's a specific category that they're coming in for, or is it kind of across the board just like everything else?
Well, I'm in private practice, so I take what walks through the door. And one of the things that I dearly love is that every person is a puzzle. So I usually see 7 clients a day, 5 days a week. I'm generally with people for 6 sessions. That's not a hard and fast number on the number of sessions, so that's pretty stable. And I love the experience of it because it's something constantly challenging and a constant puzzle to figure out. I feel like the major thing, of course, is, the connection with the client. And when someone comes in and sits in my office, they have my full investment, my full attention. If I take you as my client, I am completely 100% in that I want you to accomplish your goal, to be better. And that's just the level of commitment there. And so when I was confronted with people that I felt I would be able to help, but needed to up my game, that was an easy decision. It was just a natural progression in the business. The main thing that comes through the door is anxiety disorders. So a lot of generalized anxiety disorder, just stress all over the place. It can be family stress, it can be stress with career. A lot of sort of phobias and tics and depression. Depression is essentially a fire alarm, and the fire is the stress. So I find that if you treat for anxiety, depression tends to go away. So even though those, depression and anxiety disorders are not the same category in the DSM-5, there are a lot of things that relate into anxiety, and that is the primary area of work that I do. Kind of take anxiety as like a broader category.
Right. And if you had to kind of unravel what becomes, I know there's always customization to the individual. There's always listening and hearing what their, presenting issues may be. But do you follow a bit of a consistent pattern when it comes to the anxiety? Sure.
I mean, nothing is off the rack here.
Right.
But I do have a protocol that I follow, and I find that that's helpful. I'm Ericksonian. I use a lot of metaphor. There are certain sort of standard metaphors that I end up repeatedly using, even though they're always hugely tailored to the client. The basic metaphor will get used over and over again because I know what to expect. In other words, I generally am going to start with a 3 doors metaphor, which is a process that I do that's in like my second book, and I presented on it at conferences and stuff, which is just engaging the creative subconscious to handle stressful situations differently. So I'll start out with the miracle question from like Steve DeShazer with brief therapy, and then as we move into the session, I'll usually move to like a 3 doors process. And I know what to expect from the client in the second session. I'm interested to see what happened between the first session and the second session. And most of the time, what I expect happens. The client makes significant progress in certain areas regarding how the anxiety is playing out. We get good progress, significant reduction. The other thing, though, Jason, that's interesting is the times when it doesn't work. And when I'm working with something that I understand and I know how it operates and I know what I should expect, and then I don't get those results, what that tells me is there's something else going on that needs to be addressed differently.
Yeah,
that I'm not dealing with sort of...
Yeah, could you give an example of that, please?
Well, I mean, the easy example is, it looks like someone's got like general anxiety and stress, and, what they disclose to you has to do with like, their boss and their work situation and something like that. They come in for the second week. I'm like, what did you notice? Well, things have really not gotten better. I haven't noticed any sort of change. And then I'll start talking to them. And a lot of times what pops out at that point is, oh, I didn't tell you about like my huge trauma that I had back a few years ago. And then we know we're working in sort of a different realm.
It makes me flash back to working with somebody for, I just have a hard time falling asleep at night. And it's like the third appointment and they're just raving. They're already making referrals. And, oh, by the way, the night terrors are gone. Wait, what? Oh, yeah. This kind of unravels my take on the whole concern about can people be made to tell secrets in hypnosis? And the answer is, well, it doesn't matter because they generally walk in the door and tell you anyway.
Yeah, well, if you've got good rapport, I'm amazed if you have excellent rapport with someone, you have excellent rapport skills. When you have good rapport with someone, it's amazing what people just will open up and give, like, right off the bat. And, of course, they're walking in here for help. I don't tend to use the word symptoms a lot because my approach is a postmodernist approach. It really is not a medical model approach, even though I'm not, down on medications or medical treatment. But, when people come in with these different symptoms, I can't sleep, I'm, stressed out at work, I've got this, I'm constantly pulling my hair out. What I'll tell people is, each of those symptoms is a door into a room, but they're all doors into the same room because we're working with your emotional core, with who you are as a person. And it's emotion that's driving the behavior, and we're working at that emotional, actually, I believe in a brain level, at that limbic system level. And we're working on the same place. So I've had a number of people that I remember one woman that I was working with, like some severe anxiety, almost bordering on agoraphobia, where she didn't want to go out of the house. And we got that handled. And then she popped up with, oh, and I'm driving again. And I'm like, oh, you mean separate from going out of the house, you weren't driving? Oh, no, I was terrified of that. Oh, I was like, well, great. Like, fabulous. Didn't even know that was a problem. But here's to you.
Yeah.
So there you go.
I've nicknamed that the residual trance effect.
Yeah.
Here's the one that calls
Well,
up and goes, hey, my fear of flying was also gone. They'd come to me for a fear of public speaking, and just somehow it was connected that one went down and so did the other.
Yeah, and it is connected. Well, I think what's going on is it's the Ericksonian unconscious. I mean,
Yeah.
it's that idea that there's a part of you that naturally seeks healing. And most of the time, even the behaviors that mess people up are the subconscious trying to do something positive to help them. And a phobia is basically trying to keep you out of a dangerous situation. It's just misrecognizing the dangerous situation. It's like the smoke detector going off when you're cooking dinner instead of when there's actually a fire. But it's still a part of you that's trying to help you. And when you go in and you begin to recalibrate things, it's not just that you're fixing, for example, the flying phobia. It's that you're teaching that part of the person how to handle these things differently better. And so that part of the person begins to go, oh, I can go fix this thing over here. Oh, I can go fix this thing over here. Oh, I can go fix this thing over here. And as far as cognitive processing, it just looks like, wow, lots of things are spontaneously getting better. At that emotional level of processing, that's the part of the person that's kicking in and is just making these repairs across the board.
Well, I mean, that brings out the situation. Let's say someone calls you up and they perhaps have a bit of a list of things they'd like to address. And, very often this may pop up and sometimes they all seemingly connect to each other. But then again, sometimes you get that call that, well, I bite my nails, I smoke, and I'm anxious. And you're hearing the sort of disconnected list. How do you respond to that sort of inquiry?
Come on in and I'll help you out.
Yeah.
That's how I respond. Yeah, we can get this done. Again, in that kind of situation, what I would probably do is just start with my basic anxiety protocol and work forward from there.
Mm-hmm.
And, it's kind of the idea, if we can pull down anxiety across the board, most everything gets better. And then whatever is left standing, we can go and particularly target that. It may be that there are a bunch of behaviors that they mention in the list. And I've had people walk in with literal, typewritten lists that are multi-page.
Yes.
But, it may be that we don't have to go deal with, a bunch of the things on the list because they just kind of vanish. And then whatever's left, we can go and hit. My normal rule of thumb says, if it's probably anxiety, treat for that. If you don't know what it is, treat for anxiety. If you treat for anxiety and it doesn't work, treat for trauma. And by the time you do that, you tend to be in good shape. Now, there are places where one size doesn't fit all and people come in with really specific things and you're like, okay, this isn't so much an anxiety thing. We're working in another area. And that's fine too. Happy to go do that. But, it's generally around here, it's treat for anxiety. That'll work. If it doesn't work, treat for trauma.
Yeah, and I like the mindset of having some sort of framework, some sort of protocol to that, which, as soon as we have that, then there's a willingness to step away from it when there's a specific reason to do so. But to at least look and say that frameworks of freedom, that here's at least a good launching off point. And, I probably already have the answer having, hung out with you before, but these are things that you've kind of developed over the years just by workshopping it with patient after patient, correct?
Right. I learn a lot from my clients, and I've recently been doing presentations at conferences where I mostly talk about things I've learned from clients. And I've just learned a lot from clients over the years. I pay attention to what they're doing. I can sit here and handcraft a new metaphor for every person that walks through the door. And I did that for a long time, but I really learned several years ago not to do that because if I've got some kind of a standard format that I'm using, and then I just tailor it based on what the person tells me, and again, it's primarily what they tell me in answer to the miracle question, where I've got their emotional language. If I just tailor something that's familiar, then that gives me a foundation to work from to understand what's going on. And, then in the second session, I may do something like a fading photographs process, which is a light, kind of non-interactive, reframe history, regression-y type process. I may do something like, where you get together with your muse and you look for creative ways to move forward, sort of a creativity decision-making process. Yeah, I've got notions of several different things to do going forward. Things become much more tailored in the second and especially the third and subsequent sessions. But the general starting place being similar really helps. because you get predictability.
Right, to begin from a place where there's leverage and to get that traction. And, at the end of the day, it really comes down to that feedback and those subsequent appointments as to what's working best for them, what needs that attention, and what other issues have popped up if they've cleared away some of those initial things too.
Right, and even in the rare cases, again, where things don't work, that also is tremendously valuable information at that point. Whereas if I just tried some random thing and it didn't work, then I don't have any useful feedback that lets me know how to proceed.
Mm-hmm. Yeah, which, we could look at that phrasing of when in doubt, treat for anxiety. And if that doesn't work, treat for trauma. To look at least here's a framework to begin the process with. You mentioned something a little while ago in terms of the miracle question. And just for those that aren't familiar with that, can you unpack that a little bit more?
Sure. This was put together by Steve DeShazer and Issa Kim Berg. It's one of the basically three things you do if you're doing solution-focused brief therapy. DeShazer is a disciple of Milton Erickson, even though the approach is not hypnosis. It's just a standard therapy protocol. The way I ask the question, which is a little different from DeShazer, and I think you get his verbiage just looking it up online or even Wikipedia. But the way I ask the question, the client will come in for the first session. I'll say, I'm glad you're here. And we've already had like a consultation, so it's not the first time meeting the person. So I'll be like, I'm glad you're here. I've been looking forward to getting started. We'll, chat back and forth for a moment. Say, I've got a standard question I'd like to ask you. It's really the only standard question I use, but it's kind of good. Would that be okay? No one ever says no.
Nice.
And then I'll go, so I'd like to invite you to suppose that we have a great session today and it goes really, really well. And we get done and you head out and you've got this lovely fall day, beautiful rainy spring day, whatever it is out the window. Eventually tonight you go home, you go to bed, and you do go to sleep. And while you're asleep, a miracle happens and everything that brought you here today gets magically fixed. But you don't know that it's magically fixed because it happened while you were asleep. What would you notice tomorrow night, and the next day? What would you notice tomorrow that would be different, that would let you know things had changed? And then I start writing down their emotional language.
Yes. What's a typical response you'd get to that? Let's say with the anxiety category.
I would feel refreshed. I would wake up looking forward to my day instead of dreading it. I would have a sense of purpose as I go into my work. I would feel happy. I would feel exhilarated. People pop up with all these different terms. Occasionally people will go with not statements.
Yeah, I was about to say that. You just described the way that after further questions we eventually get that most often.
Well, no, a lot of times people go with positive statements.
Oh, nice.
I do have clients that'll go with I wouldn't dread the day when I get up, and I wouldn't feel like I want to stay in bed for several hours, and they'll list several of those, and I write those down, and then I'll let them talk for a while, and then I'll loop back in and go, if you woke up and you weren't dreading the day and you weren't wanting to just stay in bed, how would you feel? Yeah. And you can keep kind of circling back after a few minutes. I don't say do it as soon as they said that. I want to get more on the table and just see what they spontaneously generate. But I've in fact thought of doing a book of these things where I just go through and pull client folders and just write answers to the miracle question and turn it into like a book. I think it'd probably be really worthwhile. But you get some amazing things, and what you're getting is the person's emotional language. And then I wrap that through all the remainder of sessions that I do with the person. I'm going to be wrapping that language through there, even if it's not about the specific thing that they were talking about in answer to the question. If they use a word, and sometimes people will use unusual words, like if they use a word like exhilarated, then exhilarated is going to turn up a lot in their processes. Even if they're like, I'd be exhilarated when I go to work, then even if we're talking about other things that don't have anything to do with work in the process, that's going to show up. My processes, by the way, are typically not interactive. It's based on what the person has told me in the first part of the session. And I do record the processes for people to listen to later to reinforce the suggestions. So I want to put together something that's comprehensible for them to use as a personalized recording. Mm-hmm. I think that makes my session a little different from what some hypnotists do. I don't do very rapid inductions. I'll spend, 3 or 4 minutes in induction to get the person down. but in a way that's usually something just simple like a story, guided imagery, progressive relaxation, but something that they don't have to like see or feel me in order for it to work, because I'm assuming they're listening to it on audio.
Yeah. So they're getting that first pass of it live and in person, but then it becomes a resource. They can make use of it long afterwards as well. Are there sort of tips and tricks you found towards giving the instructions of when and where to listen to that, other than, of course, the not while operating a forklift?
Yeah, I've had to tell people not to do it while they're driving. I had a client one time tell me we're listening to their process on the freeway and they missed their exit by 3. And I was like, God, no, don't do that.
Yeah.
And that's even in my written thing where I send them the audio. It's like, do not do this. It's in my disclosure. It's in my written email that I send them. I verbally tell them not to do that.
We'll leave out who it was, but I had a client who came into the office one time, and the phrase was, "I hope this goes better than when I worked with," and they mentioned a rather well-known hypnotist. And I said, "Do you mind if I ask what happened?" Well, I listened to one of his recordings and nearly drove off the end of the road. And my computer was in the office, and sure enough, I had that exact audio that she had purchased from this person and played it within seconds because I knew where it was. And of course, the opening was, "This program is hypnotic in nature, should only be listened to in a place you can give it your full attention, never behind the wheel of a car." And they turn pale as they go, "Does it really say that?" I'm like, they all say that.
Yeah, because the person, whoever this is that we're not mentioning, doesn't want to be sued.
Exactly.
And more importantly, you don't want your client to be injured or harmed.
Well, yeah, that's important as well, of course.
Yeah, I mean, that's the main concern. But yeah, so yeah, no, anyway, I probably have another thought here, but there you go.
Yeah. No, I like that as the intention, which, to look at the reason why we would work in a certain way, that, if I'm of a similar slant at times, that my approach may sometimes be, if it is something that, is going to be slightly interactive, we may go back in again and do part of the session once more. And that's when I'm recording, or perhaps just carve out some time later in the day to produce something of that nature that I've, consistently found that giving them something of that nature does really help to enhance those results. I wanted to come around to something that I know perhaps a lot of people know you for, which is that specifically you've been awarded several times in terms of research, advancing the science of hypnosis. Can you elaborate on some of that, please?
Oh, I really appreciate that. Yeah, I got an award, the Hypnoscience Award in 2013 from the Hypnosis Congress in Zurich, Switzerland, I was hugely honored and surprised the socks off me, because I didn't really know these people at the time when they invited me over there. And apparently they read one of my books and they loved it. And so they liked the research that was in Emotion, the Power of Change, which is the book. And I've subsequently gotten the Hypnosis Research Award from the National Guild of Hypnotists, and really appreciated that recognition as well. I think it's important for us to understand how our processes function and operate. And at this point, enough has been learned with modern neuroimaging that I think we've got a very clear picture at a brain level of the major players, the key components, and how the processes are actually functioning. For anyone who wonders if hypnosis is something different from just waking state conversation, like if that is still an active question that you have, I would advise you to just take a look at neurological research, because definitely the brain responds differently in relaxation and in waking state. And, we're clearly dealing with something that is operating differently, not in the same territory as therapeutic conversation. So not that therapeutic conversation is bad or that cognitive therapy has no place, but I do believe firmly that emotions drive behavior, and that our processes essentially operate because they engage more or less a shutdown of cognitive processing and an engagement at a limbic system brain level. Limbic system is the part of you that's in charge of stress, anxiety. It's in charge of your survival and keeping you safe. And most everything that we look at as far as client issues are limbic-driven things. So when you're trying to handle these things or manage these things by cognitive means, which is really about the neocortex, you're essentially working in the wrong part of the brain. It's as if you've got a problem with your transmission of your car, but you decide to tinker with the engine to try to fix it. You may do some worthwhile things, but you're not really working at the level of the problem. I also feel like our language is very dated. We're still using a lot of language and concepts from the 19th and early 20th centuries. I think we have the ability now to understand those things in a better way and to express ourselves in a much more accurate manner.
Yeah, what would you say is that outdated language we need to look at?
Well, I mean, I'm not sure that subconscious or unconscious as concepts, I mean, they're nice as metaphors, but what we're really, I think, talking about, we're actually talking about limbic system processing.
Yeah.
So, the notion of body experiences like, sweating, palpitations, heartbeat, sleep, all that stuff, those are limbic functions. When you're talking about behaviors that seem conscious and cognitive, but they don't feel that way internally for the person, we're looking at something that's probably related to like the anterior cingulate cortex, which is another limbic structure that constantly comes up with this stuff. So I think the notion of limbic processing makes more sense, describes more than talking about subconscious or unconscious. When you look at conscious mind, what we're really talking about is neocortex, cognitive processing. Of course, there's still debate in psychology, psychiatry, and philosophy about the nature of consciousness, but we've pretty much run it down to something that's happening in the neocortex area. Just talking about cognitive processing, I think, is more accurate, and it really executive function processing, and it's that neocortex processing that's distinct from the limbic processing. We like to pretend that we are the little voice that we hear in our heads, that we are the executive function voice. And we like to pretend that things happen either because I decide to do it as a conscious choice, or maybe there's something driving it that's like biochemical or possibly biomechanical. The reality is the vast majority of behaviors are driven at a fundamental emotional level. They don't necessarily make sense cognitively, although we tend to rationalize things. But that limbic processing, that emotional leveling processing is where all the power is. That's like a vast river. So if we're able to work more directly at that level, which I think is what you get when you get into a relaxation dissociated state, then I think we can work more effectively to eliminate the problems.
Yeah, but you just hit on something
quickly.
That was exactly where I wanted to go next with this, which is that we can look at this limbic system, we can look at the processing of the mind and of the body and say, this is where the issue is occurring. So what would be that sort of simple explanation as to how it is that hypnosis is that ability to then access that?
Oh, it's just very simple. Basically, when as you relax, frontal lobe processing shuts down. Mm-hmm. And what I mean by shuts down is if you look at it on neuroimaging, if you look at it with something like fMRI, which is a neuroimaging process, a brain scan process that looks at electrical activity within the brain, the electrical activity dims way down. If you look at it with cerebral blood flow, which is another kind of neuroimaging, for example, that looks at blood flow to different parts of the brain, then what you see is blood flow to the frontal dramatically reduces. As you relax, it's like turning down a dimmer switch. As you relax, the frontal lobe processing goes more and more offline and essentially recedes. Well, the limbic system processing is staying stable. So it's sort of like the tide is going out and it's exposing this area of beach that you couldn't see before, but is really where all the action is. And so as that cognitive processing goes offline, I believe you're working with the person more directly at an emotional level, which is what's driving behavior. That, what you see on the neuroimaging is consistent with subjective reports of I was asleep or I wasn't thinking, or I was zoned out. And it really, as you look at it in more and more detail, it makes more and more sense.
Which this puts us into an interesting category because we can look back to definitions like the Dave Ellman definition of bypassing the critical faculty of the conscious mind, and we can reverse engineer that older definition based on exactly what you just said. But then again, let's just use the languaging of what actually is happening rather than the older metaphorical structure, or perhaps somewhere when appropriate, a combination of the two.
I think a lot of times you end up using a combination of the two because, the language is kind of
its own
locked into
hypnotic
our
induction onto its
description.
own.
Right. Well, I mean, yeah. I mean, sometimes it makes sense in a colloquial way to talk about the older language. But I find when I go to talk with physicians, I've got an entire workshop that I do that's on relaxation-based pain relief, and it's a standard of care process for non-pharmacological pain relief, and it looks at hypnosis, it looks at mindfulness, it looks at meditation and guided imageries as distinct from hypnosis, guided motor imageries, which is a physical therapy concept, and looks at a brain level how these things are functioning. Well, when I sit up there and the training is designed for physicians and other licensed medical and mental health professionals, and if I start talking to them about critical factor and conscious mind, I've immediately lost the audience.
Mm-hmm.
I have to be talking in terms of neurophysiology in order for things to have credibility at all and for things to make sense. And I've had physicians come up to me going, now this makes sense to me. I, didn't see how this operated before. You've tied some things together. You've tied together things I already knew in ways I didn't look at it.
Yeah, to look at it from the description of what is happening rather than the metaphorical and just call it out, know the audience. Almost the way back to asking the client the miracle question, using a lot of their language back at them, finding that through line as to this is what is happening rather than, again, some sort of metaphorical description. Can you elaborate a bit more on that relaxation-based pain relief?
Sure. I was invited a couple of years ago to be the keynote speaker for a palliative care group at the local hospital here, one of the local hospitals. Palliative care I have tremendous respect for these people. These are like the social workers and the nurses whose patients literally are not going to live till Tuesday. And, they're working with critical end-of-life individuals. And obviously pain relief is a huge issue in there. And I talked about, hypnotic pain relief, which honestly, Jason, to all our listeners, if you're not doing pain relief, you need to be doing it.
Yeah, I love that you say this.
And it's so simple, right? It's so simple that almost you generally get pain relief even if you don't suggest it, but even direct suggestion of you're going numb tends to work because it's so integral to our process. Dissociation and the release of natural endorphins and natural opioids in the system is just intrinsic in a hypnotic process. And so, this is an excellent process for that. And there's a lot more that you can do besides direct suggestion. Obviously, that's what the whole training is about. But, I was talking about doing this, and they were like, well, that is great. Who can we refer people to do this? And I'm like, well, there's me, which is not a good answer.
Right.
And then I got invited to speak to the State Association for Employment and Workforce. And this is doctors and lawyers that are basically there. And I talked about non-pharmacological pain relief. This was all brought up by the opioid crisis. And they were like, that is excellent. We want to be able to refer people to this. Who can we refer them to? And I'm like, again, there's me, which is not a good answer. Mm-hmm. And at that point, I decided, there just needs to be a manual on this that draws all this together because all the research is there. But the research tends to be scattered. Like when I pulled this together, I was pulling things not only from psychology and psychiatry journals, a lot from neurological journals and other anesthesia medical journals, but also things like, physical therapy peer-reviewed journals and it just out there, different things that were just out there. And so the data is there, but the research tends to be scattered. And so pulling it together in one place and then talking about these different modalities, and I went ahead and decided to make it broader than hypnosis. So it included hypnosis, but included, mindfulness, which everybody loves, and a number of different approaches that I ran across, and talked about the neurology of how these different things operate, and then went through just put together scripts, went through different scripts that you could do and different ways you could interact with patients that would be pain relieving. I spent a huge amount of time on waking state suggestion, what Erickson called ordinary waking trance. I spent a huge amount of time on waking state suggestion because there's a lot that nurses and medical technicians can do just as they're talking to their patient in normal interactions. If they're just paying attention to their language and being careful with the way they do things emotionally, they can be much, much, much more effective. And that's not even a separate like treatment or intervention. It's just using time that you're already using in a more effective manner. So I was looking at processes that medical professionals could use in clinical setting that didn't involve having to have something else you got to bill for, but could just be wrapped into your patient care that you're already doing. So very brief interventions that these professionals could do that would substantially help clients and patients with pain relief. Of course, I also have like counselors and psychotherapists and so forth in there. And then I think we can do a little more in our offices because we get a little more time with the client. You can specifically work on it. But that's the nature of that training.
Right, and that specific filter of taking what they're already doing and applying a few hypnotic principles on top of it to make it even more effective. That tends to be one of those biggest, I hate to use the term selling points, but one of those things that community is truly looking for in terms of maximizing their efforts in that time frame to get that best result with that client, with that patient.
Well, it is what they're already doing in the sense that they're having some kind of patient interaction. But like a couple of years ago, I hear my wife scream from the kitchen, and I go running in, and there's blood, and she had been slicing something for dinner with a mandolin, which is, not the musical instrument, but the really sharp bladed thing. And I had actually like bought her the Kevlar gloves and said, you need to use the little guide thing with that, but she decided not to do it. And so we had a nasty cut. And so we headed off to the emergency room, and I'm not faulting the nurse, but we go in, and the nurse, they took her right back because of blood. The nurse is like, wow, that looks like it really hurts. I bet that's really intense. Boy, we get 3 or 4 mandolin cuts in here a week. They're always really bad. We're going to have to put a lot of stitches in there.
Oh, that's good.
And I'm sitting there going, what in the world are you doing? I'm like, you need to be saying things like, wow, okay, I can do some things that will really help you. We're going to take care of you. We'll get this feeling better. I can do something that's going to be really useful. We're on top of this. That kind of thing. Just rephrasing the things. With my mother, who's 93, the last time she was in the hospital, they're like walking her to the bathroom. They're like, don't fall. Be careful not to fall. Don't fall. And I'm like, do you want the woman to fall? They need to be saying things like, you're steady on your feet. You're stable. You've got this. Be sure your handholds are good. that kind of thing.
Although I have
Say what you want, not what you don't want.
Although I was in the hospital with a family member who was going through heart surgery, and they were explaining that, the goal would be to go, through the wrist, and we go directly into the heart valve, and it's quick replacement. We actually do it under local anesthesia. That way you can tell us immediately when you feel better. We'd prefer to not do full open heart. And it's one of the first times I heard a negative, but it was phrased in a way that I go, well, that's honest. But the way that they followed it up was gorgeous to go, well, the first month, you're not going to be yourself. But then after that, you are going to be amazed how rapidly you recover and feel better. Like, well, at least there's the opening into the mind. But again, to look at it.
I would probably put that as like the first month you may feel a little bit different.
Right, yes.
Things may seem to be a bit off, but the second month is going to be great. I love that framing. And I'm not saying that medical professionals shouldn't ask the questions they need to ask for diagnosis, and they shouldn't, gauge intensity levels of pain or whatever they need to do in order to see what's really going on. But there's a lot of chit chat that happens that can be more positive. And there's also a lot of ways that things are framed that just need to be framed better. And I was invited recently to do a 2-day training in Zurich for physical therapists that specialize in head injury trauma. So their patients are people that have severe mobility issues as a result of brain damage. And they wanted to work on sort of the psychological side of communicating with patients better, with their clients better. And so it was all waking state hypnosis stuff. And I was talking about using suggestive language. And it was really interesting because it turns out the German apparently is very, very different from English. And so, I would put up a slide, give a concept, talk about what native speakers in English would normally say, what I was recommending and why it was different, and the effect we were going for. And then the woman that was there that was heading up the thing, who's lived in Zurich for 28 years, but was from here, would then say what I just said in German. And then they would talk about it for 10 or 15 minutes, and occasionally in German, and occasionally ask me a question. And then they would tell me, okay, we got it. And then we would move on to the next thing. But they were really, there was a really different use of language. They told me, this is not how I've ever thought about using language with a client. And, this sort of purposeful misuse of language in order to accomplish certain goals is something I've never thought of. And it's going to really change the way I approach my clients. But that's all about that emotional framing for success. And so the relaxation-based pain relief is working along the same lines of just equipping our conversation to be more positive and better.
Yeah, absolutely. This has been great. And where can people check out more about you online?
WatermarkColumbia.com. Columbia, South Carolina is the city where I am. And so if you're starting a new practice, you're beginning from scratch, don't name your website after the geographical place that you are. But with mine, WatermarkColumbia.com works really, it's been around for years and it works really well. If you click on upcoming events, then that always has my upcoming training there. That's on the front page, and you can just click the link on upcoming events and you'll see whatever's going on. I know this has kind of a long tail to it with people looking at it, but I'm teaching the National Guild of Hypnotists Professional Hypnosis Certification course beginning in January over several weekends. And then I'll be teaching the relaxation-based pain relief certification for licensed medical and mental health professionals at the Medical University of South Carolina, which is a major teaching and research hospital in Charleston, South Carolina. And that's March 12th and 13th, 2020. I'm looking forward this year to going to HypnoThoughts in the NGH, and had really good feedback from the UK Hypnosis Convention. So I'm looking forward to that in October, November, as well as the Hypnosis Congress in Zurich. So that, looking forward to the year coming ahead. WatermarkColumbia.com, click on upcoming events.
Awesome. And give us a quick intro to your books as well, which we'll link over in the show notes, along with those links too at WorkSmartHypnosis.com.
Well, the first book is Emotion, the Power of Change, which is sort of a basic introduction to hypnosis. The science in it is still really good, but it's essentially from 2013. So the workshops, you're getting a lot more. But the book is a really good, like if you're learning hypnosis, or if you want to add Ericksonian principles in, you're already an excellent hypnotist, but you want to kind of explore a new area and up your game there. Or if you just want to know more about the neurology of how it works, again, the science is, everything it says is still really solid and really good. Emotion, the Power of Change is that book. The second book is it's called A Different Reality. That one is a 6-session protocol for treating anxiety disorders. And so it involves 6 different hypnosis processes and how I use them, and, generally how I approach anxiety issues and disorders. And it's a really nice approach. We were talking about, having kind of protocol thinking at the beginning. That book is really good. And it's got the 3 doors process in it, which I had mentioned. The other book I have generally is only available if you take the Relaxation-Based Pain Relief Certification Workshop, but it's the Relaxation-Based Pain Relief Certification Manual. I've got it available online overseas some places. So if you're over there, hey, pick it up. It'll be great. And I really want you to look into coming to the workshops here because they're really good. So those would be the 3 books that are currently out.
Well, outstanding. And I've got all 3, read through them, and definitely recommend them as well. So thanks for sharing those.
Thank you so much. I really appreciate that comment on my books too, Jason.
Yeah. So any final thoughts before we wrap it up here?
You can do great things for your client. We have the ability with the processes that we use to help people make tremendous, deep, lasting changes, to do it very, very quickly. I would encourage you to constantly learn from your clients, study up your game, play with new processes, listen to the feedback that you get. There is a lot that we bring to the table using the hypnotic arts that just is not available in any other way in our society. And so I'm glad you're a practitioner, and I hope you will up your game. And if I can help you, let me know. I'm always happy to interact with people. Enjoy the books. Come to the workshops.
Jason Linett here once again, and as always, thank you so much for interacting with this program, for sharing it on your social media streams, or even, hey, reaching out to the guest and saying, I heard you on the program. this is what I learned from you and this is what I'd like to learn more from. I'll put all the contact information for Fredric Mau in the podcast links over at worksmarthypnosis.com. Be sure to check out his books. We'll link directly to those over at worksmarthypnosis.com. You can find out about the upcoming events at watermarkcolumbia.com. And again, check out hypnoticworkers.com. It's the all-access pass to the digital version of my hypnosis training library. Not just techniques for change, but real client sessions from start to finish to model what's working now. Check that out. Get inside. Join the community. hypnoticworkers.com. We'll see you soon.
Thanks for listening to the Work Smart Hypnosis podcast at worksmarthypnosis.com.
Hey, it's Jason here, and I want you to be the first to find out as we upload new content here online. So do this right now. Click subscribe right next to this video, and you will be the first to find out as I share further resources, further downloads, and other really cool things to come your way. See you soon.